Hello everyone, how are you all? Hope you all are doing good. Welcome back to another video. So in today's topic, we'll be seeing National Rural Health Mission. Okay, so Rural Health Mission will be given service to the rural people. We have one more mission that is called National Urban Health Mission. Okay, so this service will be given to the urban people. Rural Health Mission was formed in 2005, April 12th. Okay, by the Honorable Prime Minister of India. Okay, the main target of this Rural Health Mission is to provide the quality care, accessibility, and easily accessible affordability. Okay, these are the three targets under this mission. Okay, so for the all the rural populations. Okay, so and here this mission will especially targets some vulnerable groups. Okay, which are the vulnerable groups? Okay, those people who cannot go and meet the needs. Okay, those who cannot seek it. Okay, such people are highly targeted here, sir. Okay, so which are the such people, sir? Reproductive people, maternal, newborn, child health, adolescents, sir. Also old age people, sir. Okay, so those who cannot go and uh, reach it. Okay, those who cannot get all the services. Such people are highly targeted here, sir. This NRHM also gives services on family planning, mental health, child health, and all the old age cares also. Okay, right. So bringing the strengthening services. Okay, and facility based cares. Implementation framework. Who will implement it? Okay, Union Minister under Health and Family Welfare. Okay, he is the boss who will form it and bring into the public services. Okay, and fully functional and accountable. Okay, that is the work of this mission. Okay, see. So Union Minister he under Family Health and Family Welfare. Okay, he will form a committee. Okay, that committee will go and meet all the needs of this mission. Okay, so what are the state core strategies here? Okay, Panchayat is the boss in the rural areas. He will be trained first, okay, and given full commands to bring all health services in his local areas. Okay, that is the work of the Panchayat Raj. Okay, so Panchayat people has to bring all the public health services into the Panchayat areas in his rural area. Okay, that is the work. We will also have ASHA workers. Okay, such ASHA workers they will go and approach and deliver all the public services at the doorsteps. Okay, that is the work of the ASAs. They will go and work on it. Village health committees. Okay, so village health committees will be formed so that in every week, every month, every 15 days, this committee will assess it whether the all the health plans are actually working or not and fully functioning or not. Okay, that is the work of the village health committees. Okay, we also have subcenters, PSCs, CSAs. Okay, every 1,000 population has one subcenters. Okay, so government will provide full strengthening. Okay, and strengthening and power to the subcenters so that they will approach so they will meet all the NRHM needs. Okay, that is the work of the subcenters. PSCs and CSAs nowadays they have increased the given permission to 30 to 50 beds. Okay, that is for NRHM care. Okay, see this this service not only work on the this one also this service will work on the drinking water sources, sanitations and hygienes and nutrition also. Okay, so that is the plan was formed by Union Minister. Okay, Health and Family Welfare under this mission. Okay, that is the work of this monitoring, assessment, collections, data collections, review of the evidence based plannings and service supervisions. Okay, this is all the work of this mission. Understood? So what all the work of our mission is to giving all the health quality case, affordability and accessible to all the people. Okay, that is the work of this rural health mission. Okay, so these are the people: ANMs, MPWs, multipurpose workers, Anganwadi workers, teachers, ASAs, community health activists, and community health officers. Okay, these all are people who comes under this mission. Okay, Jilla Parishad, village parishads. Okay, these are all the people so comes under this rural health mission. Okay, so we'll see today we will discuss two of such programs. Okay, first one is National Tuberculosis Elimination Program. This program was also formed under by Health and Family Welfare only. Okay, tuberculosis is one of the biggest, and India is the first country is who is suffering with this tuberculosis. Okay, tuberculosis is nothing but a highly contagious airborne disease. Okay, is high in number in deadliest okay infection, high in number in India. Okay, every year we celebrate National Tuberculosis Day on March 24th. Okay, there is a work here. World Tuberculosis Day will be observed every March 24th. Okay, so who found this? Okay, Dr. Robert Koch in 1882 he found this TB was causing by the bacteria. Okay, and he understood it. So, what is the theme of this year? We have theme. Okay, every year the National Tuberculosis Elimination Program will be giving the themes. Okay, so the this year theme was yes we can end TB. Okay, what is the theme here? Yes, we can end TB. So before this National Tuberculosis Elimination Program was there was another name for this, that was a revised National Tuberculosis Program. Okay, so in 2020 they have renamed. Okay, so they have in 2020 they have formed it as a National Tuberculosis Elimination Program, and by ending it in 2025 means this year. So the target was to bring all the tuberculosis into the lesser number so that India can be declared as a free, a tuberculosis free. But that couldn't happen because of the populations. Okay, so lack of knowledge, lack of this thing. Okay, lack of accessibilities. Okay, so because of that, now United Nations they have decided that until 2030 we can deliver such services and bring all the tuberculosis into the base levels. Okay, that is the work of this tuberculosis. Okay, see what do you mean by TB? They have already said here TB is a airborne contagious airborne disease, primarily caused by Mycobacterium tuberculosis. Mycobacterium tuberculosis is a bacteria which causes the tuberculosis. How it spreads? It spreads through airborne. When the affected TB person will cough, sneeze, or spit. Okay, so such droplets will alarmingly harm the healthy individuals. Okay, and they will suffer and they will easily get it. Okay, this is a communicable disease. Understood? So we have there are two types of tuberculosis. One is pulmonary tuberculosis, one is extrapulmonary tuberculosis. The pulmonary tuberculosis mainly causes the lungs. Okay, so pulmonary is nothing but causing the TB caused to the lungs. Okay, and extrapulmonary that the TB causes to the lymph nodes, bones, brains, kidneys, and pleura. Okay, so these are the two main TB. So TBs. Understood? See, we have some data here. In 2020, the government had planned. Okay, TCP was revised National TB Control Program. Okay, program into NTEP. They have changed. Okay, they have renamed it. But the global target is United Nations target is up to 2030. Okay, this year we targeted that we will completely eliminate TB. Okay, and make declare India as a free TB. Okay, but it couldn't happen. So now they have targeted till the age of 2030. Okay, so that is the way. The sustainable targets, the sustainable development goals and targets are okay. 80% reductions, 90% mortalities. Okay, reduction in the mortalities. 80% reduction in the incidence and 90% reduction in the mortalities. That is the target of this uh, okay national tuberculosis elimination programs. Understood? So India is ranking first all in the world. Okay, so because of that, there is a high weightage on India. Okay, Pradhan Mantri TB Mukta Bharat Abhiyan is already running. Okay, and Niksaya is a Niksaya Poshan Yojana is a portal where we can easily target one person and the one who is suffering it, make an idea of it, and deliver all the TB drugs towards his doorsteps. Okay, that is the work of this Nexia. Okay, okay, see. Next, achievements under programs. What all things we have achieved under this program? So, in the country level, the TB burden estimations. Okay, so we have seen that how many TB cases are active TB cases, and okay, So National Tuberculosis Elimination Programs already have got the data that how many TB cases are highly active in our India. Okay. So Pradhan Mantri TB Mukta Bharat Abhiyan. Okay. So under this program, the person who is already having TB will get free of medications. Okay. Cost free medications. Then no need to pay any medications, and the voluntary who comes to the hospital and make himself, if one person is suffering with the TB and he wants to convey it to, he wants to bring his data into the governments. Okay, so such people will also get some bonus monies also. Okay, case findings. So under Nixayas, we got that there are many TB highly active TB cases are there. Okay, so such things this under this program we can easily find the cases. Okay, diagnostic services. So every subcenters, every PSCs and every CSCs have already diagnostic subcenters. Okay, so every sputums will be evaluated. Sputum AFB, sputum. Okay, sputum AFBs, CB nets. CB nets will be will the samples will be taken, and the diagnostic service will be done at the rural areas only. Okay, so in the sub centers and in the this one. Okay, so some in 100 populations we get minimum 10 samples. So we have to suspect such 10 samples to be highly targeted people. Okay, that is the service here. Treatment services. Treatment services are free of cost. Okay, then no need of paying any bills, any payments for getting the medications and getting the services. Okay, TB preventive services. IEC we can do. IEC. Okay, IEC we can do, giving the knowledges, giving the ideas, how to stop it, how to eliminate it. Okay, that is the main achievements under this program. Okay, so next, parent support system. Parent support system. So if the kid is suffering, the next to kin, the parents they have to support the person. Okay. So not only this is the social stigma. Okay, getting the TB is a social stigma. So that we should not avoid it. This is not. We can bring it. Okay. We have got. There are so many experiments. Okay. There are so many scientifically proven medications which will completely eliminate TBs. Okay, so we have already got so many results also. So that the parents, okay, parent support system, all the systems should give all this give all this so that they can have the hopes that they will be cured and highly they can become healthy person. Okay, that is the work under this program. Okay, active case findings. Okay, those who are already having TB and they are unaware of it, such people are called as active cases. Okay, medical college task force. Okay, so all the medical colleges they will be giving this as task forces. Okay, sub national disease free certifications, advocacy, communication, and specialization and partnerships. Okay, private organizations will be taken as a partnerships. Okay, social mobilizations. Okay, we have to make people aware of that, so that like in if one person, otherwise neighbors, if anybody is coughing more than 2 weeks. Okay, any blood with expectorants. Okay, such people are given counselings and get into the hospitals. Okay, that is the work of this mission. Okay, so this National Tuberculosis Health Elimination Programs work. Okay, understood. Okay, the same thing they have said here. Okay, early diagnosis. Okay, prompt treatments. Okay, that is the work, and engaging the patients seeking case in the private sectors also. Okay, if anybody is taking private treatments also, such people sir, will be linked to governments. Okay, and under the Nixa app. Okay, that is the one. Prevention and strategies. Okay, including tracings and high risk and vulnerable populations. Okay, those who people highly populated families Okay, those who stay, the people who stays under the small square feet areas. Okay, such people are highly targeted people here. Okay, so that they will get airborne infections very easily. Okay, that is a thing here. Okay, airborne infection controls. Okay, and multi-sectoral response. That is a word. So in 2005, we had 237 per lakh cases. But in 2023, we have reduced it. Okay, just because of IC programs and this because of this RNTCPs. Okay, so this is the so that in 2030 we have the hopes that we will reduce the TB cases slowly, okay, and completely eliminate it and declare it as a India free. India is a TB free country. Okay. See, I was talking about Nixia TB. Nixia is the portal where we can easily see active cases. Okay, those who are so, for example, today I am the TB positive person and I have got uh, updated myself in the Nixia portal so that from today onwards I'll be starting with the tablets. Okay, so all the tablets are given and all the accessibilities at the doorsteps only. Okay, and so that government is also giving some financial supports also. Okay, if the person uh, is the head of the family and he has got TB. Okay, so that the government is already giving pensions. Okay, portion yojanas also. Okay, see, 500 to 1000 rupees per month, others providing 3000 to 6000 patients throughout the treatment. Okay, this is the work of this TB. Okay, Nixia TB portals. Okay, understood. Any doubts here? Okay. See, which all the drugs you have already studied. No need of going into the deep because we'll be learning this thing again in the pharmacology session also. Okay. WHO has approved isoniazid, rifampicin, okay, parazinamide, okay, ethambutol. So these are the drugs we usually given in the TBs. Okay. So which all the things? Rifampicin, isoniazid, parazinamide, and ethambutol. These are the doses. Rifampicin will be given 150 mg, 75 mg isoniazid, INH. Parazinamide is given 400 mg and 275 mg ethambutol. Okay. So these all drugs have side effects also, uh, uh, in which will be learned in the pharmacology sessions. Okay. Understood. Any doubts here? Okay, next we'll move. Okay, so those who has so TB drugs will be taken up to the age of up to the 9 months. Okay, so in between, due to some inconvenience, okay, because of that, most of the people they will not continue the TB drugs. Okay, some people will be having resistance, some people will be having cannot follow it commands. So such people will go into the MDPAR, multi drug resistant TB regimens. Okay, this is the treatment chart for the multi-drug TB regimens. Okay, though the person who has already included 3 months all three medicines. Okay, levofloxacin, moxifloxacin, bedaquiline, and linezolid. Okay, these are the drugs given into the group B peoples. Okay, group B peoples are the one who is having. Okay, so overall, these are the drugs. Okay, given to the people who are having multi-drug resistance. Okay, understood. No need of going this pharmacology. We'll be seeing it in the pharmacology in a detailed way. Okay, fine. So next we will see National AIDS Control Program. Okay, every year we celebrate on December 1st, AIDS Day. Okay, so December 1st is the AIDS Day. National AIDS Control Program will be celebrated. Okay, so this program was launched in 1992. Okay, implemented for the comprehensive prevention and control of the HIVs and AIDS. Okay, so in India we have such a program is actively running. Okay, and giving treatments also for the people who are already having HIVs. Okay, people who is living with the HIV, that is called PL HIVs. People living with the HIVs. Okay, we are giving knowledge to the NGOs, all the targeted peoples, all the truck drivers to reduce the mortality morbidities. Okay, because HIV is the opportunistic infection also. Okay, so because of HIV, we also get other disease also. Because of that, we are targeting HIV's peoples. Okay, so key priorities under NACP. Okay, so what are the things? Preventing the new infections. First one is preventing new infections. So because of IEC, there are most of the cases IEC such as advertisement. Okay, advertisement free condom supplies in all the hospitals, so that they should use it and control the HIVs. Okay, so that is the main thing. Okay, preventing all the new cases. Pre- Prevention of the parent and child transmission during the time of birth. Okay, so we'll be giving the medicines so that it will stop transmission of parent child. Okay, HIV cases. Okay, that is the thing. And focusing on the ICs, okay, behavioral changes, because HIV is a social stigma that most of the people will hide it, okay. Because of that, we have to bring into their mind, we have to conclude them that this is not a this cases are treatable, and we have more success rates also. So because of that, those people should not hide it, okay, and get taken case, okay. So, providing the comprehensive care supports and treatments to the people living with the HIVs. Okay, this is the work. Okay, giving the care supports and treatments. Okay, decentralizations. Okay, including the technical supports. So such people will get all the supports. Okay, this is overall. This is the National AIDS Control Program's work. So prevention services, how to prevent it? So as I said, the targeted people, who are the targeted people? So the sex workers. Okay, these are the highly targeted people. Okay, these targeted people are sex workers, transgenders, genders. Okay, and the one who are the suffering with the substance abuses. Okay, those people also this targeted populations only. Okay, truck drivers, migrants. Okay, these are the people who are specially targeted and focused on under these national AIDS control programs. Understood? So also there is a prevention and source migrant population at the source transit and destinations. Okay, link to the work schemes. Okay, and vulnerable populations in the rural areas also. Okay, so rural areas they will get easy access IECs, and that is the okay. Um, Such people are highly educated. Okay, that is the word. So prevention and control of the sexually transmitted infections and reproductive tract infections also. Understood? Okay, blood safety in the work areas, work settings. We can see such things. Okay, in work areas, blood safety is a main thing. Okay, during the transfusion of blood. Okay, we can test it and uh, uh, we can evaluate. We can evaluate whether to be uh, taken forward, or we have to discard it. Okay, that is the main thing. Okay. HIV counseling, testing services, prevention of the parent and child transmissions, condom promotions, okay, information, education, communications, okay, blood safety, social mobilization, youth interventions, adolescents, okay, programs, mainstream HIV and responsible workplace interventions, okay. This is the main work. So these are all the things will be seen in the hospitals, okay, hospitals and hospital workers. Care support and treatment services. Okay, so during the time of HIV, we will be seeing a CD4 cell counts. Okay, this is the main uh, counts, because HIV is a cellular cell mediated immunity destroy destroyer. Okay, so because of this, what will happen? We will in every lab services we will give test kits, so that they will evaluate CD4 cell counts. Okay, and free first line and second line antiretroviral treatments also. Okay, so in every hospital we have free first line and second line antiretroviral treatments also. Okay, pediatric ART is also separate. Okay, we have early diagnosis and treatment. That is the main thing. Okay, early diagnosis and treatment. So that we can undergo every 6 months we can check up ourselves with the HIV status. Okay, so drop-in centers for people living with HIV networks. Okay, drop-in centers, treatment for the opportunity infections. So the people who is suffering with HIVs. HIVs, they may get other infections also because of that. Because HIV is a slim disease. Okay, because of that, such people will be given special priorities and given special care. Understood? So these are all the care supports and treatment services. Okay, first line and second line drugs are easy, given free of cost. There is no need of claims. Okay. Reduce the annual HIV infections 80%. Okay, mortalities are reduced by 80%. So this is the two main targets. Okay, 80% HIV, HIV we have infections we have to reduce, and 80% mortalities we have to reduce. Okay, new infections we have to control. That is the main target. Okay, National AIDS Control Program. Okay, next to the treatment plans. So treatment plan is not only included with the medicines. Okay, there is we can include with the mental health treatment plans also, because HIV is a social stigma, so that the person who is suffering with HIV will be continuously in the suffering, continuously in the agonies. Okay, for such people needs mental health treatments also. Okay, modality of the specific treatments also. Okay, psychodynamic therapies. Okay, continue behavioral therapies. Okay, so these are the therapies we can give to the people. Okay, counseling treatments, we can give them hopes and bring into the client based issues. Okay, because such people are such treatments also will be included here. Okay, substance abuse will be given the special priority those who are addicted to the substances. Okay, such people also will get the substance abuse treatment plans also. Okay, behavioral health treatment plans. Okay, another one is behavior health treatment plan. Okay, in this what will happen, mental health and substance abuse issues will be dissolved. Okay, that is the word. See, HIV opportunistic infections. So, CD4 cell counts more than 500 ml. People will be having acute HIVs and vaginal candidiasis. This is the infection here. And people who is having CD4 cell count between 200 to 500 per mm of M3 M cubes. Okay, such people will be having bacterial pneumonias, pulmonary tuberculosis, oral thrush, and orally hazy leukoplekias, herpes zoster, Kaposi's sarcomas. Okay, people who are having CD4 less than 200, Candida esophagitis, Toxoplasmosis, okay, Cryptococcus and Pneumocystis cerevisiae pneumonia also. Okay, these are the things. And CD4 count less than 50 are the people who is having disseminated mycobacterium AVM complexes. Okay, these are the opportunistic infections. The one who is suffering with CD4 counts. Okay, the one who is suffering with the HIVs. Okay, so on the in that people, okay, CD4 counts will be evaluated, and based on that, such people will get such all the infections. Okay, all the opportunistic infections. Understood? So treatment plans and their side effects, everything will be detailedly explained in the pharmacology classes. So no need of worrying about it. Okay. So next part is come to treatment plans. First one is jodovedine, lamivudine, stavudine. Okay, the tenofovir. These are the treatment plans we use in the antiretroviral therapies. Okay, first line drugs and second line drugs. Okay, that is not categorized here, but you can see the slides. So which all the drugs will be having the side effects also. Okay, so these are the drugs will be having side effects. Can be seen in we will uh, see these all the we'll study these all the things in a pharmacology class sessions. Okay, fine. So this is for today. We have not gone into the deep just because this is the high topics. Because of that, we have brought into the notice. If you have any doubts, you can contact us, and if you have any queries, you can comment us. Okay, we'll resolve all your problems. Okay? Thank you.